Welcome and thanks for joining us. My guest today is Randy Ruta, the Chief Executive Officer of the National Health Council. Randy, thanks so much for coming on with us today.
Absolutely, Nick. I really appreciate being here.
Yeah, we appreciate having you. So we're going to talk about healthcare infrastructure, the delivery of healthcare, and some of the factors that are affecting healthcare delivery around the country. Let's start off by talking about rural areas. There are gaps sometimes in healthcare delivery and healthcare infrastructure in rural areas around the country. How are patients with chronic illnesses impacted by that, and especially if they have disabilities? How are they affected by those gaps in healthcare coverage in those rural areas?
It's a really good question. And some of these gaps have been long-standing. Some of the ways in which our system is organized has never really reached those far rural areas, or in some cases even deep into an urban area. And so for those individuals concerned about their health, their families, access to care by virtue of where it's physically located, or maybe access to those specialists for whom there's just not that many around, and so they have to go to centers of excellence. So as you described that, I think for people in rural areas, they're relying on us keeping those safety net programs in place. They rely on those programs, particularly Medicaid and Medicare, to really have access to the services they need. That's their source of insurance. And they also are looking to have those extending kinds of things. What about telehealth? What about those ways in which they can, receive their medicines through the mail or connect to their physicians via telehealth options, which means then they don't have a 2 or 3 hour drive to the nearest center or facility.
I was going to ask you about that. A lot of those times they're driving a long ways for care, right? Yeah. It's not necessarily in their community. They're going to have to go to maybe a different county or something like that.
And if you're a person with a chronic condition, a disability, maybe a recent illness that needs repeated visits, that's a lot of drive time. Yeah. And for patients, for all of us, there are other expenses in our lives, and so the cost, literally, of that commute, the cost of maybe having to stay overnight, is really challenging.
And if you have to drive and you have to put all that effort into it, you may not get care when you need it, right?
Well, that's right. Oftentimes, that's enough of a deterrent for people that they just let it go.
Right.
And you might see parents just making the drive, making the investment every single time, but then skimp on their own prevention, their own doctor's appointments, their own accessing of the medical community, because it just, in the mix of the day between work and meals and all the other responsibilities, it gets tough.
So we talk a lot about federal funding here in the D.C. area,
yes.
Cuts to federal funding. If federal funding is reduced for programs like Medicaid or ACA subsidies or medical research, things like that, what are the potential consequences for patients?
Patients are really concerned because that truly is their safety net, to understand their health, collaborate with their physicians about managing their health, and then also benefiting from, let's say, research that could be cutting edge, that's bringing an understanding or a medicine to them that has just not been available before. So the prospect of cuts, we can always find efficiencies. All of us feel that, our system should always be under scrutiny to do better, do more with the resources we have, maybe reallocate those resources differently. But the idea that resources from Medicaid or Medicare, the subsidies that support people in those Affordable Care Act marketplace insurance plans, cuts to those programs that doesn't reinvest that money right back into health care is pretty concerning for these patients.
Are we seeing a lot of that right now with federal funding cuts?
We're seeing both a lot of that being discussed is the potential, as we have reconciliation and certainly the 2026 budget conversation underway. These legislators always, at state level, they're always having to look to see what can we afford, where can we find savings, how can we reallocate them. But right now there's a lot of pressure on these legislators to find significant cuts or reorganize in a significant fashion that could really take resources off the table that have now or could better be invested in patients' health, and also maybe start to undermine some of those core supports, the infrastructure. You mentioned workforce. There's a shortage of nurses and doctors and other healthcare providers. We need to be investing in bringing more of them into the medical community, the healthcare community. These cuts really undermine the ability of the system to support itself in that way. Same with research. We saw an awful lot of earlier this spring, targeted cuts to funding of research programs, both at the federal agencies, NIH, CDC, FDA, as well as in academic settings. that really is the lifeblood of how it is patients improve access to new medicines, new devices, and how the United States stays best in class in those spaces, because we truly are almost miraculous in what we're able to accomplish on behalf of patients and their families in that space. Boy, we don't want to see that undermined.
Another big topic here in Washington and around the country is tariffs, along with the federal funding cuts. We're talking a lot about tariffs these days. How about tariffs and their impact on imported medical supplies? How does that impact patient access and affordability, especially if a patient is managing a long-term condition? What is the impact of the tariffs in those situations?
Well, I appreciate you asking that, Nick. It's a very real impact, and in part it's because it either calls into question whether that supply chain is reliable for a patient that needs that medicine, needs that device, or the medical community around them that wants access to sterile equipment and supplies. The tariffs, by raising the cost or putting barriers in place for us to be able to access those medicines, those materials globally, and it truly is a global marketplace when it comes to supporting patients in their health. So the tariffs really represent both a higher cost to a system that's already struggling, perhaps it gets passed on to patients. It represents an uncertainty. And, patients have enough stress in their life trying to manage their health care, stay healthy, help their kids. So the tariffs are a concern because it's about the reliability of the supply chain, it's about the potential for shortages, and then the negative impact. If someone can't access their medicine or a surgery can't be performed because the supplies to support that surgery can't happen, that has real consequences for patients.
Speaking of patients, patient-centered healthcare policies. When you think about a patient-centered healthcare policy agenda, what does that look like specifically to you? And how can policymakers, lawmakers be directed to focus on those priorities around that?
I appreciate and endorse that question, Nick. Patient-centeredness is what we have to be about. Everybody in the healthcare system and all the decision makers around healthcare, and the United States invests a considerable amount of energy and resources in our healthcare system. We talk about that being patient-centered, but oftentimes then the patient really isn't at the table in helping to understand their health and thereby be a part of keeping themselves healthy. They're not necessarily consulted in a way that what's important to them is how their health care gets structured. And, for our constituency, the National Health Council, we've got over 180 national organizations representing patient groups and clinicians and nurses and other partners to patients, business and industry. We're directly focusing on the needs of people with chronic conditions, disabilities, ongoing and continuing illness. That's more than 160 million Americans. And so when you think about patient-centeredness, we are there to help those patients directly, help decision makers, policymakers understand what's important to them. We will help look for efficiencies and ways to get good cost benefit from the investments are made. And as patient organizations, we'll be part of putting those solutions in place.
I wanted to ask you about nonprofit advocacy groups focused on patients. Since we're talking about patient-centered care. What role do those types of groups play in protecting access and quality of care? And how could changes to their funding or their tax-exempt status affect their overall mission?
Well, that's great to acknowledge that the nonprofit sector plays a huge role in the American experience, in healthcare certainly, but across so many different areas of activity. Our membership focused on, with missions focused on advancing patient health and well-being. These are the trusted organizations that have been around for decades oftentimes, that families and individuals rely on. The American Cancer Society, the Heart Association, the Lung Association, Crohn's, colitis. These are exactly the organizations that provide educational support, that convene and engage patients with their clinicians and other parts of the healthcare system. Our organizations like that have been bringing their patients directly to Capitol Hill to talk to legislators. They're their constituents to help them understand, as you make these challenging decisions about complex, policies and how that plays out in healthcare, here's what's important to us. And then our patient organizations are partners to those lawmakers in making sure that they have the best information. And then as they make decisions, we work with them to implement those new rules and regulations to best serve patient need.
And it occurs to me, as you say that list of organizations, a lot of times we hear those names more than like a hospital or,
Right.
or an insurance company or something like that. We hear those names even more frequently than those other organizations.
That's often true. You know, healthcare really is a whole constellation of expertise and direct intervention and support. And so our job as patient organizations is to kind of make that align in concert with what we know patients need. So these organizations are oftentimes funding research that directly relates to that therapeutic area, that medical condition that those patients care about. We have registries that'll help match those patients to new research and try to support them in making decisions about whether that might help their health and how it might help the health of others as discovery leads to new treatments, maybe cures.
All right, Randy, very interesting stuff. Thanks so much.
Thank you so much, Nick.
That is Randy Ruda, the Chief Executive Officer of the National Health Council. I'm Nick Iannelli, and for more information on this series, go to WTOP.com and search the Healthcare Agenda.